has a respiration of 26, and number 4, second stage of labor whose contraction are lasting for 60 seconds. So what is the answer? So first C means first first is equal to priority. So we have to look for the patient who is on our priority. Number 2, deep. Number 3, second stage of labor who has a respiration of 26. Okay. Number 3, 2, 3, 2. Canadian girl 4774. She said 4. Number 2. So, okay, we will go with the number 1. Okay, so now ask yourself, which client has the biggest risk to mom or baby if I wait, right? Then danger beats and then expected findings. Nalongo. Can you please write down your rational, Nalongo? Can you please write down your rational? Uniquely designed. Sukh, Rashmi. Sukh said 3, Rashmi said 2, Gloria 2, MS 1, 2. Okay, so we will go one by one. Okay, next we are going one by one. So number 1, first stage of labor who has oral temperature of 99.7 degree Fahrenheit, slightly elevated, not a fever. .4 degree Fahrenheit. So, most important thing, keep in your mind, mild temperature increase are normal in labor. So, no immediate danger to mom or baby. So I'm gonna cross number 1. Wait, where is the razor? So I'm going to cross number 1. Number 1 is not our answer. Next is number 2, first stage of labor whose contraction are occurring every 30 seconds. Next is number 2, first stage of labor contraction first stage of labor whose contraction are occurring every 30 seconds means big red flag. So normal first stage contraction first stage contraction every 3 to 5 minutes. The first stage should not be every 30 seconds. Yes. So every 30 seconds means uterus has no rest. So it is our big red flag. Decrease blood flow to placenta. And then decrease O2 to fetus. If contractions are occurring every 30 seconds, so decrease blood flow to placenta and decrease O2 to fetus. So it is our big red flag, contractions every 30 seconds. So I'm gonna hold number 2. Let's see the other options. Okay, so other 3, number 3. Second stage of labor, who has respiration of 6. So basically respiration 6 is mild tachypnea. Tachypnea. Okay. Pain, anxiety, pushing. So might be because of those. Okay. So no sign of severe respiratory distress. I'm gonna cross number 3. Then number 4, second stage of labor, contraction are lasting for 60 seconds. So strong long contractions are expected in second stage. Got it? And normal during pushing. So this is normal and the right answer is number 2 is the right answer. Got it? So why number 2? Because the risk of fetal hypoxia. Make sure you guys write down everything. So risk of fetal hypoxia and distress. Guys, double tap. Everyone, guys, double tap, double tap. So the client, number 2 client is the priority. Guys, got it? Okay. Now number 2. So number 2 is the nurse is observing a staff member caring for a client who has chicken pox. Which of the following action by the staff member would require the nurse to intervene? As the first year student in science who want to get good grades, what is the best advice? Number 3. Okay. So the keyword here is intervene. You are looking for the action that is incorrect and unsafe. Unsafe and incorrect. When you see like intervene, you have to look for the unsafe and incorrect answer. Okay, so now we will do and break down everything. So number 1 is okay, so placing the client in a private room with monitored negative air pressure. Placing the client in private room with monitored negative air pressure. Okay. So number one is yes, placing the client in a private room with monitored negative air pressure. So for airborne precautions, okay, for chickenpox, yes, airborne precautions are required. So it is correct. Prevent spread through the air. So we don't need any intervene in this one. Number one, I'm gonna cross it. So this is correct. We have to look for the wrong. Number two, placing a box of disposable face shield outside the client's room. Everyone said 2, 1, 3, 3, 1. No. 2, sim, 3. Okay. So placing a box of disposable face shield outside the client. I'm gonna hold this. Let's see. Number three. So placing an alcohol-based hand rub in the client's room for hand hygiene. Okay, hand hygiene is always appropriate. Alcohol-based rubs are acceptable. I'm going to cross number three. That's really true. We don't like we put alcohol-based hand rub and we use like alcohol-based sanitizer. So next number four. Placing a surgical mask on the client during transport out of the client's room. That's true. Correct for airborne isolation, prevent spread when client leaves room. So the answer is number two, placing box of disposable face shield outside the client's room. So face shield do not protect against airborne particles. Make sure you write this. Face shield do not protect against, guys, double tap. Only 60, why only 65 people are here? I think I have to share the live or what? Against airborne particles. They are not a substitute for N95. So staff must wear an N95 respirator or mask. So this require intervene. Rugal, you were saying like soap and water. That's for contact precaution. That's for contact precaution. Hi, Simbo, please, everyone, guys, repost the live. Repost the live. Got it? Guys, got it, this question, or should I repeat? Any doubt or anything? Oh, it's okay, it's okay, it's okay. No need to say sorry. Okay. So here, next question. The nurse is caring for a client who report feeling faint and is experience a cardiac rhythm shown in the electrocardiogram strip below. So firstly, we will look for the ECG. She 36 minutes for. Hello, Simbu, can you explain? Sorry, what she said, can you explain? Sinus bradycardia. Okay. So what are the keywords here? First, we are looking for the keywords sinus bradycardia. So feeling faint. Number one is feeling faint means symptomatic. Patient is symptomatic, right? and this is a sinus bradycardia. Guys, double tap, please, 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 double tap. Next, ask yourself, is the client stable or unstable? Ask yourself, is the client stable or unstable? So client is stable or unstable? Yes, the client feels faint. Next, symptomatic bradycardia means client is unstable. Symptomatic, so client is unstable. Got it? Okay, so next. So common symptoms, dizziness, fainting, hypotension, and chest pain. Yes, so client is unstable. So NCLEX rule here, NCLEX rule, slow plus symptoms is equal to speed it up. Think sport circulation, guys, double tap, please, double tap. Prevent ischemia, and prepare for pacing. Now we are going to break down each option here. Okay, number 1, administer the client's prescribed beta blockers. Yes or no? Red flag. It is a red flag. Why? Because beta blockers slow down the heart rate. It's already a sinus bradycardia. So this would make bradycardia worse. So not appropriate. Number 2, prepare for transcutaneous pacing. That is yes. We are going to do that. That is correct. Indicate symptomatic bradycardia used when patient is unstable. So that is appropriate. Okay, number 3, instruct the client to perform the Valsalva maneuver. Yes or no? Yes or no? Number 3. Number 3, yes or no? Simbo, why yes? Why yes? No. Preeti. No. Corby, no. Yes. So number 1 is no. Number 3 is no. Instruct the client to perform the Valsalva maneuver. This is a red flag. Because it slowed down the heart rate. This Valsalva maneuver slow down the heart rate. Why? Because it is also sinus bradycardia, right? So we can do this. It is contraindicated. So no for option 3rd. Next, number 4, begin chest compression. Yes or no? Begin chest compression. Yes or no? Yes. So this is no, not correct. This is also a red flag. Client has a pulse. Client has a pulse and chest compression are for cardiac arrest only, not for sinus bradycardia. Next, yes, it will slow the heart rate. Next, number 5, yes or no? Number 5, yes or no? Oh, no. Assess the client for angina. Yes, number 5 is the answer. So, bradycardia. Bradycardia decrease cardiac output, coronary perfusion, then chest pain. So this is a appropriate nursing action. Okay, I'm going to tell you something. Guys, double tap, double tap. NCLEX red flag. NCLEX red flags. Fast rhythm. Fast rhythm. Then what we have to do? Slow them. Next is number 2 red flag is equal to slow heart rate. So it is wrong. Number 3 CPR, no pulse, wrong. So pacing for symptomatic bradycardia is right. Guys, got it? Take a screenshot if you want. Oh, sorry. Okay, so next. So yes, 5 is the answer. Next is the nurse is planning care for a client with moderate Alzheimer's disease. Which of the following intervention should the nurse include in the client's plan of care? Number 1, encourage the client to reminisce about happy memories. Confront the client when inappropriate or agitated behavior occur. Administer to the client whatever is it inhibitor to reverse the course of Alzheimer's disease, then provide the client the information about activity choices in the morning so the client can make plan for the day. So what is the answer? Number one, Comfort Brown. So keyword here is planning care. Thanks for the rose. Okay, so wait, let me do here something. So moderate Alzheimer's disease disease is equal to short-term memory, impaired and oh shit. So what happened in Alzheimer's disease? Long-term memory relatively preserved. And increase confusion. This is for moderate Alzheimer. Confusion, agitation, and anxiety. So what is the NCLEX rule here? Okay, we are going to write down here. NCLEX rule do not expect reasoning, planning, or learning new information. Okay, so what is the answer here? Number 4, sexy RN. Number 1. Okay, 1, 1. Guys, please double tap. Why not 2? I don't know, 4. 1, 1. Okay, so I'm going to cross number 4. Provide the client information about activity choices in the morning so the client can make plans for the day. No. So the right answer here is number 1. So this is a therapeutic and sportive intervention. Yes. So, okay. Then number 3. The nurse is teaching how to ambulate using crutches. So which of the following information should the nurse include? Thank you. Oh. Patient can't make plan for themselves. Yes. So which of the following information should the nurse include? So what is the keyword here in question? First, wait. Don't jump to the answer. What is the keyword here? Last the key C answer. Number 1. So guys, please double tap, share the live with your friends. Please. Wait. Before we start with the question, let's see what is the keyword here in question. So keyword here is teaching. So this is our keyword. This is a safety plus mobility question, right? Safety plus mobility question. Yes. Teaching, Simbo, good job. Teaching, yes. So it is the safety plus mobility question. So you are looking for the correct crutch walking instruction that prevent injury. Got it? So some safety rules here I'm going to teach you. Number 1, wait goes through the hands, not the armpit. Number 2, oh, what is this? Number 2, crutches placed slightly in front and to the side of the feet. Next, elbows should be, notebook is better or here? I think notebook, right? Elbows should be slightly, notebook is better or this one? Elbows shows notebook. I have to write. Okay, so elbows should be notebook, both. Okay.